Marburg virus disease, also known as Marburg hemorrhagic fever, is a rare and severe illness caused by the Marburg virus, a member of the Filoviridae family of viruses. The disease was first identified in 1967 when outbreaks occurred simultaneously in Marburg and Frankfurt, Germany, and in Belgrade, Serbia, then Yugoslavia, among laboratory workers who had been exposed to infected African green monkeys. Since then, sporadic outbreaks of Marburg virus disease have occurred in several countries in Africa, including Uganda, Angola, and the Democratic Republic of Congo. The Marburg virus is transmitted to humans through contact with the bodily fluids of infected animals, particularly fruit bats, which are believed to be the natural reservoir of the virus. The virus can also be transmitted from person to person through direct contact with the bodily fluids of an infected individual, including blood, vomit, urine, feces, saliva, and semen. Healthcare workers and family members who care for infected individuals are at high risk of contracting the disease. The incubation period for Marburg virus disease is typically 5 to 10 days, during which time the infected person may experience flu-like symptoms, including fever, chills, headache, muscle aches, and fatigue. As the disease progresses, the symptoms become more severe, and the patient may develop severe bleeding, both internally and externally. The disease has a high mortality rate, with death occurring in up to 90% of cases. There is currently no specific treatment or vaccine for Marburg virus disease. Supportive care, including fluid and electrolyte replacement, management of bleeding, and treatment of other symptoms, is the mainstay of treatment. Early diagnosis and isolation of infected individuals are critical for preventing the spread of the disease. Prevention of Marburg virus disease involves measures to reduce the risk of exposure to the virus. These include avoiding contact with infected animals, particularly fruit bats, and avoiding contact with the bodily fluids of infected individuals. Healthcare workers and others who may be at risk of exposure should wear personal protective equipment, including gloves, gowns, and masks, when caring for infected individuals. The control of Marburg virus disease outbreaks involves a multidisciplinary approach, including surveillance, contact tracing, isolation and quarantine of infected individuals, and the implementation of infection prevention and control measures in healthcare facilities. In addition, public education and awareness campaigns are important for promoting understanding of the disease and encouraging behaviors that reduce the risk of transmission. Despite the serious threat posed by Marburg virus disease, research on the disease and the development of treatments and vaccines have been limited. This is in part due to the rare nature of the disease and the relatively small number of outbreaks that have occurred. However, recent advances in technology and the increased recognition of the importance of preparedness for emerging infectious diseases have led to increased interest in research on Marburg virus disease. In conclusion, Marburg virus disease is a rare but severe illness caused by the Marburg virus. The disease is transmitted through contact with the bodily fluids of infected animals or humans and has a high mortality rate. Prevention and control measures, including avoidance of exposure, personal protective equipment, and infection prevention and control measures, are critical for controlling outbreaks of the disease. Increased research on the disease and the development of treatments and vaccines are needed to better understand the disease and to prepare for future outbreaks.